To the first Chautauqua CARES Community Connections Program. My name is Dina Randazzo. I am the CARES Program Coordinator with the Chautauqua County Sheriff's Office. And today's kind of an opportunity for the community to kind of connect with local providers and also different leaders from different parts of the county to talk about forensic mental health and the efforts being done in the county to reduce recidivism. So today we have Chautauqua County Sheriff Quattrone. We have Kia from Chautauqua Center. We have Carmelo Hernandez from Chautauqua County Department of Mental Hygiene and Social Services, and Steve Kilburn from Public Health. Before we get started, I'd like to kind of say special thanks to Chautauqua Center for allowing us to use their facility. Also, some providers that are on site here, the Resource Center, Safe Point Lighthouse, Healthy Community Alliance, Goodwill Good Skills, and VA Outreach Services. So thank you all of you for coming and participating. Without further ado, I'm going to introduce Kia here, who's going to start us off. Kia?
I work at the Chautauqua Center here in the Dunkirk site. We have many locations, but that's where I'm at, and I am a clinical social worker here. So I just wanted to give a little bit of a synopsis of what we do here. We have individual counseling. Last year we did do some groups, but due to the shortage of counselors right now, we're just keeping it at an individual counseling level. So that ranges from anything with mental health issues or substance abuse. We also have an awesome psych team, quite a bit of them, so it's pretty easy to roll people into getting the MAT treatment. For those with opioid dependency, it's pretty, I would say, very easy to link people up with medication services here, so that's been something that's made it really neat to see. We don't have to wait for a long period of time to get them in. Basically we work as a cohesive team. We have meetings together to go over people's treatment and just to do the best we can to help those in the community. I think that's pretty much it.
Okay. Thanks, Kia.
Yeah.
You bail out.
I'm going to bail out.
All right.
Okay.
So next I will introduce Sheriff Jim Quattrone.
Thank you, Vito. So some of you have already heard this, but it's going to be a repeat. Why are we here? You know, when we talk about the recidivism, the issues that are going on in our county, but really it's not unique just to Chautauqua County. We're seeing these problems across the nation. I would say part of the reason my interest and my passion for the CARES grant and what we're doing there and the hub and the reentry program is we've been fighting this war on drugs for over 50 years. And I say war, on my notes I have the air quotes there, because I think when we talk about a war, it gives the wrong impression of what we're trying to do. But how we've been doing this is with strict enforcement. We've been doing it with long incarcerations, and when the vast majority of the money that is allotted towards enforcement well overshadows what is for treatment and what is for prevention. And so, and it depends on who we're talking to. If we talk, I had shared in the past week or so, I've been doing some research and looking at some numbers, and I can find people who will say we're doing a good job on the war on drugs. And I can find people who say we're doing a poor job on the war on drugs. And what I like to look at is, the research is good, the statistics are good, but we also have to look at anecdotally. What are we seeing? What are we seeing in our county? What are we seeing in our communities? And unfortunately, what we're seeing is too many people dying of drug overdoses. And we want to lower that number. We also want to lower the number of people who are repeat offenders. Or repeat users. Unfortunately, many times we are dealing with the same people who are overdosing. I've shared before throughout my career, quite honestly, I've enjoyed arresting people, but those are people who needed to be arrested. And what I was seeing is we are arresting the same people over and over and over again. Yeah. So back in 2010, I started with a couple of my friends, an organization called UCAN to help people who are getting out of jail, prison, and rehab. And while I'm no longer with that organization, I see that we still have to be willing to help those people who are getting out of jail, prison, and rehab, and just prevent them from coming back. And quite honestly, it's something, I think it's the humane thing to do. It's the right thing to do. And just looking around this room, I don't know many of you, but I think we can all say we know somebody that has been impacted by the drug epidemic. Maybe it's a family member, maybe it's ourselves, and or somebody in our community. The quote that I've heard, or the definition of insanity, and depends on who you talk to, what it is, but doing the same thing over and over again and expecting different results. That quote has been attributed to many different people. I've come up with Albert Einstein, that may have been the one that originated that, or Al-Anon, or Narcotics Anonymous, or George Bernard Shaw, and then actually the list goes on. So I don't know who it is. I continue to use that quote because if we continue doing the same thing and expected a different outcome, we're going to continue to see this drug epidemic, and we're going to continue to see death in our community. Just a 5-year look back at the Chautauqua County Jail. We had about just under 5,000 separate offenders, unique offenders in the jail. Now, of those nearly 5,000, about just over 1,300 of those were for drug offenses, which is about 27% of the total number of people that were in our jail. Of those 1,300, 1,049 of those are repeat offenders. So about 80% of our drug offenders are coming back into the jail within a 3-year time period. And then the average ages of those individuals were 33 years old. Those numbers aren't unique. Those numbers aren't a lot different than from the national averages. We were looking at some of the national numbers. About 50 to 80% of the individuals that are in custody suffer from behavioral health issues, drug addiction issues, and depending on the jurisdictions, you may see a higher number or a little bit lower number. But we also see about 600,000 people being released from state and federal prisons, and many more being released from the local county jails, with about a 60% of those are being returning, having a rate of recidivism, being arrested within three years. And a lot of that is due to untreated mental health issues. I had shared earlier this week is one of the, I believe, unintended consequences of bail reform is we are seeing people who are coming into the jail that have more serious illnesses, both physical and mental health issues. And part of that is because many times the people in the jail, when we ask them who their primary care physician is, they mention the doctor who's working in the jail. When we ask who their counselor is, they talk about the counselor that's in the jail. And unfortunately, they're not always seeking the assistance when they're outside of the jail. So we have a reentry coordinator in the jail. She works hard with those who are being released to connect them with services once they are released. And at least for about the last year and a half, we've been looking, it's closer to 90% of those who leave the jail with a plan are not following up with their appointments. So that's the reason we've started the reentry hub, which is like across the street from our jail. We can't mandate that the individuals go there. We can encourage them. We can try. Some of it comes from other incarcerated individuals telling each other that they can go there. And that the goal of the hub is to connect with the services. Unfortunately, I believe when people are leaving the jail, they are well-intentioned, that they're going to connect with the services, and by the time they get to their home, which is the vast majority is either in Jamestown or Dunkirk is where they're going, they have given up and are going to connect with some services that aren't authorized, are not helpful for them. So we want to continue to work with those who are being released, work with those who are in the jail to try to connect them with the services. And unfortunately, a lot of these people don't ask for help. And so we have to reach out. We have to be proactive with that. I also know that many of their family members are struggling dealing with not only the incarceration, but with those who are struggling with addiction. So we want to be able to support the family. And an interesting statistic I found is that 75% of the people who remain engaged will reach recovery or remission. So that's what we want to do. We want to continue to be reaching out, not just while they're in the jail, not immediate post-release, but on a continual basis, and letting people know that not only are there services in the county, and I looked around, the services we have here today are great. There's other services. Sometimes it's difficult to remember what the services are or even how to get the services. And I see each of you guys here working hard to get the word out. I know what they are, and sometimes when we're trying to work with an offender, I have to reach out to somebody else and say, well, what else can we do? And they'll bring up a provider and say, oh, I forgot about them. So if you can imagine somebody who's struggling with addiction to remember and know how to access, I can understand the difficulty and the frustration they will get. One of my motivators, and I shared, was a few years ago, I was coming up to work a little after 7 in the morning, and there was a gentleman sitting in the Mayville Park, and recognized that he had just got out of the jail, so I went to go over to talk to him. He'd been in for 8 or 9 months into the jail. Very happy to get out. He had remembered me from a previous encounter when he was a victim of a crime when he was 8 or 9 years old. And I did not remember him, so he reminded me of who he was. And he was committed, and I believe him. He was committed that that day that he was going to make his appointments, he was going to stay clean, and a couple weeks later, he had died. A drug overdose on a park bench. They found him there, and that's something. When 100 former prisoners, former incarcerated individuals, are 129 times more likely within 2 weeks of their release to die of an overdose. We can do better, and we need to do better. 65%, this is a number we came up, another statistic, 65% of inmates suffer from substance use disorder. And 37% of the inmates in state and federal prisons, 44% people held in local jails have a history of mental illness. But we are seeing this co-occurring, both mental health as well as substance use disorders. And so we want to reach out. One of the things I did here Monday when we did a similar presentation is we don't often hear the success stories. And I shared, and I think one of the things that happened in my career, the probably most rewarding is back in the year 2000, we had a female incarcerated individual who delivered a baby. They came back to the jail with the baby for a few weeks, but we were able to have the staff, our medical staff, our correctional staff, working with her, really helping her to understand how to care for the baby. She hadn't had that before. I'm proud to say that she has been out of jail for almost 4 years now, doing very well, managing a store in the community that she lives in, and I see regular updates of this. Her daughter, they are just doing great. But it's nice to see this is somebody who struggled with addiction for many years and many of the consequences of that addiction. And so we see that recovery is possible. And so, thank you again for all of the work that you're doing. Thank you for Vito for spearheading this. And we need to just get the word out. So again, thanks a lot.
Thank you, Sheriff. It really is. That's why we talk about CARES. We talk about the network of providers. I know in my experience in the years I've worked with kids and adults, and there's always an old saying, it takes a village to raise a child. But really, the issue with mental health, forensic mental health, substance addiction, recidivism, this takes a community. And that's why CARES is really about bringing providers together and connecting them with the individuals that need the help and to kind of have a greater impact. So with that said, the next person we invite who obviously has a huge impact responsibility is Carmel Hernandez, who is our Director of Mental Hygiene and Social Services.
Hey, good morning. So just to piggyback off of thank you guys for coming, first of all, but just to piggyback off of what the sheriff was stating, war on drugs, right, in over 50 years. And I could say this from someone who's deployed to both Iraq and Afghanistan. So textbooks and historians would say, yes, we won this war. And I could tell you personally, as a person who's been overseas and who's been in combat, I don't know how they keep a tally. I don't know what constitutes a win and a loss column. And when you use the word war, nobody wins in war. All you have is trauma, all you have is chaos, and all you have are fatalities. So when we say the war on drugs from the law enforcement side, I'm sure they've been in some engagements and in some things that has impacted each and every one of them. On the other end of the spectrum, on the some perpetrators, some unfortunately people who suffer from substance use disorder and or families, right, and or communities, they're impacted as well. So when you look at the war on drugs, I kind of chuckle when it's used, especially on the political landscape. It's like, this is, you obviously have never been to war because you don't know what the outcomes are, and the outcome is just what we just spoke about. With that being said, I think that it's two things. First, it's a multifaceted approach, right? You look at substance use, you look at how big this opioid and fentanyl, I mean, you could take it back, but it touches like everything from our little ones to our families to communities to law enforcement to recidivism to just it just continues. It's like it just doesn't stop. And it could be overwhelming and exhausting as providers, as you're constantly showing up day in and day out, and you're trying and you're giving it your best shot, and it's like, oh, 6 over here in one night, oh this one here, and it's like an uphill battle. You feel like a hamster sometimes, and it's why I think it takes looking at the whole gamut, but having everyone that's looking at it play their position and play their role, kind of like good team members. And I look at, like, for example, next week I'm going to meet with a couple of partners, or hopefully potential partners, I should say, contacts in New York City for housing and what they're doing and what's working, and how can hopefully bring some investors to help collaborate up here to help us with that, because a big piece of reducing recidivism in the jail is going to be housing. It's going to be your access. It's going to be hope, right? We were just at the Hope and Healing Conference, is having that hope to really stay clean and make it to the other side, whatever that other side looks like for the individuals. That's one piece. I think the other piece for me, which is it's such an uphill battle and it's not doable. It's just one of those things that I know it's going to take years to really come out on the other side of it. And that's why I believe in the youth, and I believe is really planting those seeds for trees to grow that we may never sit in the shade of, which is okay, but is planting them, imprinting, and help guiding them to, hey, you could make a better decision, or we don't have to go down this route. We don't have to become the statistic. Unfortunately, I mean, we got to look at the poverty too, right? And when you look at that kids are not safe, child welfare side, then you have substances. So I see it every day, Monday through Sunday. Monday through Sunday, in one way, shape, or form, it touches either personally or professionally something that we're doing hands down. So I say all that to say, on the other side of it is, there is opportunities to get better, and while we continue to strive for perfection, we'll be excellent. And we do have something unique that I could say personally as being from a big city. In big cities, you don't meet like this. You don't get this opportunity. Everybody's working on their own, and it's just maximized, right? You may have one or two maybe community agencies that like each other, and then the rest of them just do their own thing. That's really the truth of the matter. So we do have a unique opportunity here in Chautauqua County to be able to sit across and say, hey, look, I understand we're looking at business perspective, you got your ROIs, you got, overhead, sustainability, all of that. But I can also sit here and say, I do not mind sharing the workload with each and every one of you. I do not mind at all. It was a quote I heard in a podcast, and this to me was ironic but also important. The question was, what makes a good CIA agent? And she worked in the CIA for 28 years, and she goes, what makes a great CIA agent? They're charismatic, they're intellectual, they're able to engage, they're able to extract information, they're able to move in and out, they're able to do all these unique things. But you know what's really makes them a great agent? That they could stop World War III, and they don't need to brag to nobody that they just stopped World War III. And that stuck with me, because I don't care who saves us from this epidemic and could get us to the other side. I don't need the credit. I don't want the credit. I'm sure everybody that's in this field doesn't need it and doesn't want it either. And I think the more that we come together and just focus on the mission, and the mission is of hoping to save lives, right? And save as many lives as possible, and to help them get to the other side, whatever the other side is for them. I think that's what we're all here for. So thank you, and thank you for your time, and thank you, Vito, for putting this together.
Thank you, Carmelo. Thank you for that. And obviously, we've talked about law enforcement involvement. We've talked about, obviously, behavioral health. We've talked about, obviously, mental hygiene and the county's aspect. The next collaborative is from public health, and obviously public health, people think, probably physical health, but really they have really a very broad spectrum in terms of overall health, which obviously includes the work we do. And Steve has been very instrumental in kind of with the CSARP and behavioral health and law enforcement collaborative committees about bringing providers together and kind of working together that normally probably would not. So at this moment, I'd like to introduce Steve Gilbert.
Thank you, Vito. I want to thank the sheriff and Carmelo. I thank them because they've made some excellent comments, although they also made it harder to go after them since they've shared so many good comments. But I think I will, those of you that were here on Monday know I kind of had it a bit interactive. I won't do that so much now, and I'll try to be a little briefer even. But I think I'll use a phrase that, we are all familiar with. Vito alluded to it earlier. It takes a village to raise a child. And I definitely echo Carmelo's sentiments that the village that we have in the form of the multiple partners that work so well together is an absolute strength. And I have seen it in my own experience here. But I've also learned, as Carmelo alluded to, that's not something that's a given, and other places don't necessarily have that level of cooperation. So we have a real strength there. But to take the phrase a little bit farther, it takes a village to raise a child. And well, let me say this: there are some villages I wouldn't want to raise my children. Namely, it doesn't take just any village to raise a child. It takes a well-informed and well-organized village. And I'm using the analogy of a village here to refer to the community of people that are working hard just for the moment in this space about addiction. It doesn't just take a lot of people, it takes a kind of organized and well-informed group of people working together to address addiction. And that is really what we're seeking to do from a county level, is have a plan that we can help us all work in kind of a cohesive and collaborative way together. So, the nature of that means that we try to establish what are goals, what are we attempting to accomplish, how will we know if we got there, and what are the most pressing issues that we are facing as a county in regards to addiction. I've worked as a crisis counselor in the emergency room, seeing people at their sort of greatest crisis, if you will. I've worked on a rehab for many years and worked with folks working towards their recovery, and now work on a public health level. And one thing that has always stuck with me is that there are so many, let me just put it this way, addiction is very complex. And any attempt to reduce it to a single idea, if we just did more of this or less of that, it is almost by definition going to be wrong because it's too limited. So our plan has to be comprehensive. Carmelo said that. Let me just quickly run through what the elements of a fairly broad, comprehensive plan we believe would best look like in Chautauqua County, given the experiences, the data, the realities that we're facing. Number one, we need to reduce overdose deaths. The sheriff has made reference to this already. Last year, 2023, we had the most drug overdose deaths in the county in history for our county, 61. It's a sobering, tragic number. 61 means, every less or more often rather than every week, somebody, on average, somebody is dying. I do want to also say, and this is where, while the numbers can kind of make our eyes glaze over sometimes, there are good reasons to be mindful of the data. One of them is very good news, namely that from November of 2023, since November of 2023, we have seen a distinctive drop in the number of drug overdose deaths. In fact, from November through May of this year, 7 months, the number of drug overdose deaths was half what it was during that same period a year prior. In 1 year, a reduction by 50%. This is good news. It's hardly, I'd say it's good news. There's still too many people dying. It's a good trend is really what I should say. And it's one that we want to be mindful of, monitoring and continue hard work to try to reduce those numbers even more. And there's a lot, why would that have happened? Again, any attempt, if you heard me say, well, here's why that happened, you should really question whether I'm understanding the complexities of addiction. There's a lot of reasons why it's happening. And they do range from getting drugs off of the street, certainly the distribution of Narcan, literally thousands of Narcan kits being distributed and being used. And a host of other things, treatment, the things that you do every day are contributing to this. But I do want us to understand that there is progress happening. But we want more. And so number one goal, what can we work on? What are the many ways we can reduce overdose deaths? Secondly, we want to expand access to, engagement in, retention in, and the effectiveness of treatment. We have a lot of treatment options in our county. We actually do, including right here at the Chautauqua Center. But as the sheriff alluded to, if people don't know about them, then they're not going to be effective. And frankly, and this is something that's not maybe often said, but it's proven in the form of surveys, etc., consistently. This isn't opinion, this is proven fact. Most people with an addiction are not looking for treatment. This isn't simply an access to treatment problem. This is also helping people move along the stages of change. And that's not saying a negative thing about people struggling with addiction. There's a lot of things in my life that I know would be healthier for me and much less powerful than the drugs which contribute to chemical dependency. Exercise. It's no secret to me. I'm fully aware of the benefits of regular exercise. It's not a knowledge problem. And it's not a lack of gyms. In fact, I have a treadmill in my house. I don't even have to go anywhere. The problem isn't access. The problem is I'm more at the contemplation stage of change than I am at the action stage of change. But things could move me along that continuum. Maybe meeting somebody who's really doing really well with their exercise program. Hopefully not, but it could be a bad report that says you need to exercise or else. So my point simply is that to be a wise, well-informed, well-organized village, if you will, we have to take these realities seriously. How can we help people move along the stages of change? And the hub is one of those things. As the sheriff has said, when people are coming into the hub, they are generally, because they're voluntarily walking into that facility, they're very motivated. How can we keep that motivation strong? Because motivation moves. It changes. It goes up, I get on the treadmill, and then it goes down. And I can't even see the treadmill because it's covered with all kinds of other stuff. So you get the point. We want treatment to be not only available to people, but to encourage people to utilize it and to stay with it. And we need to be mindful of the amount of stimulant use happening in the county. It's huge, and we need treatment that's going to really help there. Reduce overdoses, expand treatment, engagement, retention, and effectiveness. Thirdly, and actually I should have said this even earlier, prevention, and Carmelo has very rightly said, it's getting upstream, and I love the picture that he uses, that we would plant seeds today under the trees of which we may not sit, but it is still so crucial that we do that. So we prioritize prevention. Families. I don't have to know your stories, but I could take as a given that there would be probably most of us in this room, just from a statistical point of view, would be no more than 1 degree of separation away from active addiction, meaning we know somebody. I say that because the best educated guesses are there's probably about 18,000 county residents with an active addiction in a county of about 125,000. And each of those people know and impact how many? 3, 4 at least? That's a conservative number. Just do the math and you realize it's most of the population who knows somebody or is themselves suffering from chemical dependency. And the family members are both suffering and are influential in ways that we want to support and help them. That's one of our goals. I believe I'm up, that's number 4. 5, workforce. And that's us, right? As Carmelo also, as I said, everybody's had all the great insights already, but I'll just echo to say what you do and what our colleagues do across the county is hard work. Very hard work. Some of the hardest work actually that's out there. And whereas people go into it, I think, because knowing that it will be hard, finding that even rewarding that it's difficult, it can't be soul crushing. It needs to be a kind of work that we're supporting people who are in the field and making attractive that work to get more people in the field, because many of you, I'm sure, have agencies that are having a hard time even recruiting new people into the field. Let me just round off here quickly and hope I don't forget one of these 7 points. You've heard me quote several statistics, etc. It takes a well-informed village to raise a child, and we need good data. We do need good data. We cannot just hope for the best. We owe it to people who are suffering from this, from addiction, and their families, to be able to demonstrate that what we're doing is effective. It's not enough to say we're busy. We have to be able to say we're busy and we're getting better all the time. Or if we're not, to say, how can we get better all the time? So a public health approach really requires that we bring in data. And I think the only other one that I haven't mentioned, but it again echoes what's already been said. As I pointed out or asked sort of last Monday when we met, we often do ask, why do people use drugs? Why do people use drugs? And maybe another way to ask the question is, why do people who don't use drugs not use them? Why do people not use drugs? Well, there are good reasons. And they're all the reasons that we want to help other people, because these are the larger social determinants that make a difference. People that don't use drugs typically had, not in every case, but a stronger childhood without trauma. They have stable housing, supportive families. Their financial status is is such that they're more stable in that regard. And a host of other ways. They have resources to be able to cope with stresses, etc. And I say all of that because so many people are lacking those things for no fault of their own. So the social determinants of health, housing in particular, I'll look forward to hearing. I hope Carmelo comes back from his meetings coming up with signed contracts for people to come in and start construction here by the end of the summer. We need stable, recovery, supportive housing and other social determinants to really address the broad complexities of addiction. So I'll leave it with that. Those are the plans that we believe are going to help this village do the very best and continually improve in providing services. Thanks.
Thank you, Steve. So yeah, obviously, as you probably heard today, obviously it's a very complex problem that needs a complex, very comprehensive solution. So thank you everyone for coming today. Obviously, again, thank you for the provider at Chautauqua Center for allowing us their space. For you guys at home, if you guys ever have questions, you can reach the CARES program at 716-753-4088 or CARES, C-A-R-E-S, at sheriff.us. Thank you.
The teacher in me comes out. Do you guys have any questions for us?
I'm sorry.
I just thought about that. Well, that was good then. Oh, no, okay.
So I have this for Carmelo.
Yeah.
The housing, like what, I don't know how much you can talk about it, and if it's like classified or whatever.
Nah.
What are some like the prospects for the county, like more specifically?
Well, so it's multifaceted. It's one, I do believe we have the land. I do believe that there's properties that could be not refurbished, but just improved to be able to utilize. So going through it's twofold. There's one is having investors that are willing to come in, preferably from the private sector because they have the money available already. And if they're a strong nonprofit, they'll have good funders. The other piece is the process that it takes from the state level with OTDA. And that's approximately a minimum of 3 to 5 years, I believe. And just in terms of all their regulations, getting everything ironed out, and then being able to reimburse the reimbursement that comes down from the state. So it's really, I think the key is finding someone that has done it, right? And that this is their expertise, and that they're willing to do it, and they're willing to expand.
Cool.
Anybody else?
Let us off the hook. Thank you.
You're all very good speakers.
No.
Is this, can I ask, is it